With Eclipse fully integrated in Halaxy, medical specialists and GPs in Australia can process in-hospital claims with private health insurers in just seconds. With Eclipse, all you need to do is create an invoice, then lodge your claim with just a click of a button, and it only costs 1 credit per successful transaction. In this tutorial, we'll first take you through setting up your practice for Eclipse claims. Then we'll show you how to lodge your first Eclipse claim. If you are new to Halaxy, please note that you must have a verified profile before you can register for any online claims processing. You can click the link below for information on how to get your Halaxy profile verified. Let's start with the first part, setting up your practice for Eclipse claims. There are a few things you need to do and enter into Halaxy to automatically populate the required information whenever you lodge a claim. Let's go through this checklist one by one. The first item on our setup checklist is to enable the Eclipse integration. On the sidebar, click Settings, then Users. Next to your name, click the First Aid Kit icon. In this pop-up, tick the checkbox that says Enable Medicare Eclipse Billing. Click Save. You've now enabled Eclipse claiming for yourself. The next item on our setup checklist is to set up the hospital you're lodging claims from as a Halaxy location. On the sidebar, click Personal, then Locations. If you've just joined Halaxy, your first location is already created for you, which you can use to set up your hospital. If you've been a Halaxy user for some time and you already have another practice location set up, you can add the hospital as a new location by clicking Add Location in the top right. For this tutorial, let's edit the existing location. Next to the location name, click Edit. In this pop-up, enter the hospital's business details, such as its name, ABN, and address. Then click Save. Then, next to Facility ID for Eclipse, click the Edit icon. Then enter the hospital's Medicare provider number. Click Save. Next, you need to request a Medicare location ID for this location. This registers your practice at this hospital to submit online claims to Medicare and also receive rebates using Halaxy. Click Request a Location ID, then follow the steps in the pop-up. You can also check out our tutorial video on how to complete this process. When the hospital's Medicare location ID is activated and verified, you'll be eligible to lodge online claims from that hospital. Next on our setup checklist is to import the preset Private Health Insurance Funder. This configures the billing and claim structure on all invoices used for Eclipse claiming, such as which practitioner or patient information is displayed. On the sidebar, click Finances, then Fees, then click the Funders tab. In the top right, click Add Funder. In Lookup, type Private Health Insurance and select it from the drop-down. When the funder is imported, click Save. Next up, you'll need to import your partner health funds as organisations, which you'll later set as the paying organisations in patient claims. On the sidebar, click Contacts, then Organisations. In the top right, click Add Organisation. For name, enter the private health fund's name and select it from the drop-down. Make sure that the health fund's name is labelled with Eclipse. For type, select Fund. Configure the rest of the health fund's details as needed, then click Save. You've successfully imported your partner health fund. Repeat this step for every fund where you are registered as a provider. Up next, you now need to add your actual identifiers that Eclipse requires. First, add your identification with your health fund. Still in the health fund's organisation profile, under Claim Details, click Add New. Select the correct claim type code for this health fund. You can find a table of claim type codes for health funds in our Eclipse reference guide, linked below. For Fund Payee ID, enter your unique ID issued by this health fund that identifies you as a partner provider. If your health fund doesn't issue this, enter your Medicare provider number. When you're finished, click Save. Remember to do this for every health fund where you are a registered provider. Now you'll need to add your funder identification, which connects your provider number to the practice location. On the sidebar, click Finances, then Fees, then click the Identifications tab. If you're adding identification for another practitioner, select their name first in the practitioner drop-down. Then, in the top right, click Edit. In the Private Health Insurance row, enter your provider number from Medicare. If you are lodging Eclipse claims from multiple locations, make sure to enter the provider number under each location column, then click Save. If you have completed all the steps in this setup guide so far, the last 2 items on our checklist can be done whenever you lodge a claim. Let's try that now and prepare an invoice for our claim. Click the Halaxy logo to open your calendar, then select the time and date that you treated the patient. Enter the patient's name. If they are a new patient, you can add them directly from here. The next item on our checklist is to import the correct fees to use for your claims. Under Fees, enter the name or item code of the fee you are claiming. Make sure to select the correct fee by noting the following. First, make sure the fee is under the private health insurance funder. Then you must also check that the fee name is labelled with the correct fee schedule for the health fund you are claiming with. In this example, the fees have the same funder, item code, and name, but differ in fee schedule according to state. Lastly, if necessary, select the correct gap specification. Some fees with the same fee schedule and item code are specified for whether you are charging a gap fee or not. If you are charging a gap fee, select the fee labelled Known Gap. If you are not charging a gap fee, select the fee labelled No Gap. If a fee does not have a gap specification, you can charge a gap fee on it. When you've found the correct fee, click the name to import it. In the pop-up, configure the fee details to your specifications. If you are charging a gap fee, set the amount value to the rebate value, plus the gap fee you are charging. Do not edit the rebate value. When you're ready, click Import Fee. You've just added the fee to your practice's fees list, and it can now be selected again for future claims. To add more fees to this claim, click Add Another Fee. When you click Save, the invoice is automatically created. The last item on the Eclipse setup checklist is to enter the patient's claim details for their health fund to verify their eligibility. After saving the appointment, you can enter your patient's private health claim details directly from the appointment panel. Next to Member Number, click the Edit icon. For Paying Organisation, enter the name of the patient's health fund, which you imported earlier, and select it from the drop-down. Invoice Schedule is an optional feature that allows you to set a schedule for collating fees into a single invoice at a specified frequency, such as weekly or monthly. You can leave this blank to generate an individual invoice for every appointment. Enter the patient's member number and member reference number. If the patient's fund membership has an expiry date, enter it. If they don't, you can leave this field blank. Leave Payer set to Patient, then click Save. Now, inpatient claims in Eclipse also require patient's Medicare card details, so let's quickly add that. Click the patient's name to go to their profile, then click the Funding tab. Click New Claim. For Funder, type Medicare and select it from the drop-down to import it. Then, enter the patient's Medicare card details. Click Save. You can skip adding a referral and click Not Now. You've successfully added the patient's claim details to their profile. This means that when you create another private health insurance appointment for this patient, their claim details are automatically populated. Alright, you've completed all the setup requirements for Eclipse. You can now begin Part 2, which is lodging your first Eclipse claim in Halaxy. After you've created the appointment with the private health fees, click Invoice. Review its details to ensure it contains all the correct required information. Your Eclipse claim must include practitioner details, provider identification, patient and health fund details, and the correct fees. When you are ready to lodge your claim, go to the Payment section of the invoice. If you are lodging an overseas claim, next to Inpatient Claim, click the down arrow, then click Overseas Claim. If you are lodging an inpatient claim, click Inpatient Claim. In the pop-up, review the claim details and your credit balance. When ready, click Process. Your claim is submitted to Medicare through the Eclipse integration. If the claim information is valid and complete, Medicare sends the claim to the health fund for approval. When the health fund approves the claim, you receive payment in the bank account you registered with the health fund. To monitor the status of your claim, click Request Report or View Report if a report is ready. You can also view claim history on this invoice by clicking the claim status. That's it. You're all set up and ready to go from here on out. Remember, For future private health claims, all you have to do is create a patient appointment with the correct fees, configure the patient's claim details, then lodge the claim from the invoice. It's that easy. Well, healthcare can be complex. You can simplify it with Halaxy.